today, what I'm going to be talking about is another side of things that we do here at the National Aspergillosis Centre. So in the little cares team that me and Graham and Lauren and Seren and Chris are all part of, another thing that we do a lot of is providing information for patients. So I'm just going to kind of go through who that's for, what sort of things we provide, and how people find things online. And then at the end, I'm going to tell you about our newest website that is launching today. So, online information about aspergillosis. So, to start with, why do patients need information? Like, you know, you've got your diagnosis. Why can't you just hand somebody their prescription and that's it? It's a lot more than that. So, especially for something that's quite a rare condition and you know, quite frightening when you're first diagnosed, having a lot more of an understanding of what's going on, it gives people much more of a sense of control over what's happening. And when people know what to expect during their treatment and understand, is it likely to be successful? Like how much better might they feel? How long is it going to go on for? It makes it a lot easier to tolerate, especially side effects, especially things that come with antifungals. Sometimes it can be quite unpleasant. And also with antifungals like azole, sometimes you need to know a bit about how to take the medication correctly. So do I need to take it with food? Should I take it with an acidic drink? This sort of thing. And what sort of side effects might occur. Also, what people say to their friends and family or their employer, they need to know how to explain what's going on. They need to understand it themselves before they can tell other people. And that's how they can get help from their support network. The more they know about what's going on with them, the more they can get that support. And also from a sort of a safety point of view, you need to know when to call for help from a nurse or a pharmacist. So for NAC patients, when to call our team. And it's especially true with something where somebody maybe has other conditions and other medications. People need to know when to call in, what's something to worry about. And just as a little, just to put some numbers on this really, there's a paper came out recently in China. So it's quite a different medical system to the NHS, but it's just an illustration to show how important this kind of thing is. So they looked at patients who just stopped going to their appointments. So they call it lost to follow up. So they weren't discharged, they weren't told they were cured, they just stopped turning up and stopped answering the phone. And actually what they found was the people who understood what was going on, they stayed in follow-up a lot more. So the proportion of patients with relevant knowledge of CPA, so chronic pulmonary aspergillosis, including disease severity and what the treatment was like, in the regular follow-up group, it was about 54% versus only 14% in the people that left, which is a huge difference. And actually, when they got in touch with the people who'd been lost to follow up, 85% of them didn't even understand what their treatment was really about. They didn't know how long it was meant to last, and they didn't know that they needed the therapeutic drug monitoring, so the blood test to check their voriconazole levels. So a lot of them, they were getting side effects, and they were just thinking, oh no, this is making me ill, I'll just stop taking it, I just won't bother. And actually, sadly, quite a lot of those people did end up, they died. So it's the understanding makes a massive difference, absolutely huge. So why? Obviously, we give people a lot of information in their appointments, and there's leaflets. So why would online information be important as well? Because we you know, everybody knows about it. Don't ask Dr. Google, because everything you search is cancer, and there are all sorts of dodgy rabbit holes to go down on the internet if you look up medical information. But the thing is, we're all human, and I've put at the top this this phrase, nature abhors a vacuum. People are going to Google things. They're going to. And there's a huge amount of misinformation online. And if the first thing that they come to is this misinformation and it's saying, try this fad diet, buy my supplement, buy this oil, if that's the first thing they come to, that is extremely dangerous. What we need to do is make sure that there's the good quality information is what they come to first. And honestly, patients can only take in so much information in an appointment, especially when it's technical things. People don't remember. Like, it's very overwhelming and probably quite upsetting in the first and some of the appointments. And if you don't understand all the words that are being used, it's a lot. And so what we try to do is have some reference material that people can come back to after the fact if they forget or if they just want more detail, because different people want different levels of information as well. So I've put the phrase here, toxic information. Not everybody wants to know everything. So it's very important that people can really choose what level of information they want. And if you see one of the pictures there, that's one of the quack remedies that we see recommended a lot that we have to keep on top of in our support groups. It's called colloidal silver, and people recommend it for any old thing, and it doesn't do anything. And also it sometimes turns people blue. So the man in this picture that looks a bit like Papa Smurf, he turned himself blue permanently. And even things that aren't supplements, even things that are more like diets, so don't eat this, don't eat that. If somebody's struggling to keep weight on, the last thing they want to really be doing is restricting their diet in ways that aren't really going to help. So that, yeah, there's a lot of bad information out there. So what good information is available for patients? So first, before I say anything else, always, if you've got a medical question, it's not for the internet. You need to ask your doctor, your nurse, or the pharmacist if it's about the medication. You cannot necessarily get a question that answers you personally online, because a lot of it, especially with aspergillosis, the different types are very different, and each person's situation is very, very different. So you cannot use general purpose advice from online as medical advice for yourself personally. So that's really, really important. So as well as the NAC Patients and Carers website, which the link's at the bottom, and our YouTube channel. So all of these talks are going to appear on the YouTube later. There's a lot of guides and practical advice that we've developed with the Fungal Infection Trust, who very kindly supported that. We've got Zoom and Facebook support groups, and that's really good for peer support, so sharing emotional and coping tips, and did this happen to you? That's very important. General health information websites that are always winners. The NHS website, obviously I have to say that because they're paid. No, they are really good. And Cleveland Clinic is very good. It's in the States, but they have a lot of good articles, and health.harvard.edu is very good as well. They're reliable. And if you want sort of general things more like COVID, BBC News is always, it's more reliable than pretty much everything out there. So the flip side of that coin is, why do doctors need online information? So you might think, well, they know everything right already. They've been to medical school, don't they know it already? Actually, aspergillosis it is a rare disease, and we're finding out more and more about it every year. And the tests that you use for it and the treatments that you give people, how you prescribe, they're constantly being updated. So somebody who's maybe a GP or a respiratory consultant, who isn't an aspergillosis specialist themselves, they might not have every single thing already in their head. They might need to sort of look things up on a case-by-case basis. And more that's being done online. mostly because if you do things online, if you do courses online, it's cheaper, it's more convenient because you can do it at your own pace. So a lot of the accredited activities, a lot of them really are online. There's a lot online now. And we actually do our own called MIM on a platform called MIMS. That's for GPs. And that's a really good one if anyone's interested in that. And also for people's just not so much courses, but sort of personal development. A lot of doctors are on Twitter now, and they'll promote research they're doing or clinical trials that they're trying to promote to get more people to recruit for. And sometimes sharing, if they've had a really interesting case or got a really nice microscope slide of some fungi, sometimes they'll anonymize it and then share it on Twitter so that other people can all learn from it, which is really, really nice. But having said that, information written for healthcare professionals, it's not always very suitable for patients to read because it's partly it's very technical. It tends to be a lot more technical, and it's just got a bit of it's got a different focus. So if you are a patient and you're reading something that says at the top, this is for healthcare professionals, just be cautious because it might not be, if it's not written for what you need, it might not be the best thing. So what's available for doctors? So as I said, our MIMS learning course, that's mainly for GPs, and that just covers the different types of aspergillosis, and it's just like a really good overview. Our lab MRCM website, they've got a blog that has more information about the tests. So recently we had a few articles about if a condition's not responding to the treatment, what do you do then? Like what tests should you run? That sort of thing. The CDC has a lot of good stuff, especially things like Candida auris it's very good for. At the university, the Aspergillus website and microfungi.net and the Life website and YouTube channel, they've got a huge amount of information, and it's free training for doctors. And there's also a few on FutureLearn that BSAC have developed. So those are courses, and there's a lot out there basically. And on the top left, there's just some thumbnails from MRC, CMM. They do a seminar series that's very good called Myco Talks. If you haven't seen it before, I'd recommend it. So new as of today, we're launching a new website called NHS Mycology Cases. So it's a little bit different to other resources out there because it's based around case-based learning, and it's specifically focused on things that you'll see, things that doctors may treat in the NHS. So it's for doctors that aren't necessarily aspergillosis specialists or even microbiology specialists yet. So if a GP or a consultant starts treating somebody with aspergillosis, they could use this as a reference just to familiarize themselves with some of the issues and what sort of tests and treatments are out there. It should be quite good as well for clinical fellows or medical students who maybe want to do a rotation in microbiology. Anyone joining an infectious diseases team, it will be quite useful just to get people hit the ground running. And medical lab staff can read it to see things from the side of the doctors ordering the tests, which should be quite useful. So the link is there. It's a bit.ly at the moment. And at the moment, it's only got the aspergillosis cases up there. It will be expanding as time goes on. And it just runs you through, there's each case. We've been very clear because we have a lot of interaction with patients in our team. We thought it was important for each case. It's not just some scans. Each patient has a name and a photo and tells their story in their own words, which I think is very important for doctors learning. And it's very interactive. It asks you interactive questions, and we're going to be adding in soon, hopefully, more cases from an ebook that our department wrote a few years ago, and a lot more about sort of how to interpret tests and antifungal stewardship, which is sort of to do with prescribing to prevent resistance happening. So it's going to be a really good platform. It's small at the moment, but it's going to grow.